This meeting is now being recorded.
All right, Maggie, do you want to go ahead and get us started?
Yes. Hello, everybody. I'm Maggie Wiegand. I'm actually the chair of the inaugural chair of the FLASCO Administrator Network. So welcome, everybody, and thank you for being here. Just to explain a little bit about the Administrator Network, the mission of the network is to be consistent with the overall mission of FLASCO and to enhance communications among practice administrators and other leaders of oncology within the community oncology practices, hospital-based practices, and academic practices, especially relating to operational and reimbursement issues. FLASCO is committed to facilitating and promoting multidisciplinary efforts to improve patient care and in providing a unified advocacy voice with Medicare, Medicaid, and private payers. So we really felt that this was something necessary within our own network to really gain more knowledge and feedback across the board as to what each of us are doing. I would also like to introduce Gail Enrich, the Practice Manager of Cancer Centers of Brevard and Vice Chairman of the FLASCO Administrator Network. Gail, are you there?
Yes, I am. Hi, everyone. And I'll just correct everybody gets my last name confused, but it's Gail Ehrenreich, and I am Director of Clinical Operations at Cancer Care Centers of Brevard in Brevard County, and I've been at my practice 30 years. And I would like to say that we would like to thank everyone for joining us today to allow us to have the best webinar experience possible. All attendees will be muted while the speakers are presenting. During this time, you can submit your questions by clicking on the Q&A bubble in the top right of your screen, or by using the public chat function in the toolbar on the left side of your screen. Following the presentation, we will open the meeting to all questions.
Okay, great. Thank you, Gail, and I apologize for that little
oh, that's okay. Everybody does.
Yeah, well, the people do that to my last name, too, so I understand. Our first speaker today is Elizabeth Marshall. Elizabeth is an oncology social worker at Memorial Cancer Institute, where she participates in a multidisciplinary team approach to the treatment of her oncology patients and the support of their families. Last year, Elizabeth assisted over 1,200 patients, registered over 500 patients for services with the American Cancer Society, and recovered thousands of dollars in patient assistance while her patients actively underwent cancer treatment. For over 8 years, Elizabeth has been involved in the fight over cancer, beginning in 2007 as a community representative of the American Cancer Society. Elizabeth organized and led events educating the community about available patient services and advocating for the oncology patients and their families. In 2010, Elizabeth obtained a master's in social work from Barry University. Elizabeth's experiences have led her to become an oncology social worker for the Memorial Cancer Institute. Elizabeth coordinates successful informational and educational events called Lunch and Learns for the Memorial Healthcare System, located in Hollywood, Florida, healthcare providers, oncology patients, caretakers, and their families. Elizabeth currently serves as a social worker representative for Memorial Cancer Institute that meets the Cancer Committee that meets regularly at Memorial Regional Hospital and Southeast Cancer Control Collaborative in Palm Beach. Additionally, Elizabeth has served as the 2012 and 13 registration chair for the FSOSW statewide conferences and is 2014-15 FSOSW regional representative and 2016 nominations chair. Elizabeth regularly dedicates time to volunteer with many worthwhile causes, including continuing her advocacy and education work for the American Cancer Society by facilitating the Ribbon Women's Warriors Group, Walderstrom Tri-County Group, Look Good, Feel Better, and its Man-Thing support groups. Elizabeth has spoken at various conferences around Broward County and at the 2013 Day of Caring Breast Cancer Center conference, for which she is 2015 Cancer and Careers Ambassador. Each year during the Thanksgiving season, Elizabeth undertakes the provision of Thanksgiving baskets to cancer patients and their families. Welcome, Elizabeth.
Thank you, Maggie, and thank you, everyone, for coming. Wow, we're up to 55 participants. I really appreciate this. Well, my name is Elizabeth Marshall. I am an oncology social worker. I work for Memorial Cancer Institute, and I'm very happy to be here today. So please follow along with my presentation so we can navigate a little bit more together. So where to start? You know, everyone looks at the patient, and sometimes we have to look at it from their point of view. You're that patient in the center. Sometimes they look at you with that confused look, or, you know, they don't know what to do. And part of the role is just finding out who to speak to and when to speak to, and who are the people on your medical team. What is your treatment plan going to look like? And are you planning to work during treatment? And trying to plan out, you know, at least from one appointment to the next, if you're going to plan to work during treatment or are you not planning to work on treatment, and coming up with those plan of options. And then seeing what your insurance is, because everyone says, I don't know what my insurance covers. I pay them every month. I should have everything included. That's not always the case, and who you should speak to regarding that. Okay. So patients come into our centers obviously distressed because sometimes they prolong even taking treatment because they're afraid of the cost or they're afraid of missing work. And we understand that, at least in Memorial, because we want to make sure we're there for the patient and the family as they're going through treatment by showing them, you know, the importance of accessing to care. So a lot of it is just looking for help, asking questions, knowing who to ask, and, you know, even if you have to ask the same question multiple times, it's still asking that question on your medical team in order for you to help yourself, really, in that aspect. Okay? The role of an oncology social worker. So I get every single day, what do you do? And every single day, my job changes. You know, one time, throughout the day, each patient is a different experience. It's a different situation. You know, a lot of it is looking into examining the problem and seeing where it actually fits with the tools in my toolbox and then finding out how I can assist them. So, again, my job is to connect not the medical part of it, but the other things that are still associated when a patient gets a diagnosis of cancer. So I'm like part of the puzzle in there. You know, I work with the whole team here. So I work with the service providers, meaning the doctors, the nurses, the dietitians, things of that sort, and then we connect everything together either when there's questions. So another thing that we really look at, and sometimes patients don't even realize because you're so used to going into appointment after appointment, there's a huge psychological piece when you're working with patients that have been developed with cancer. Sometimes it doesn't affect patients on the first visit. It affects patients as they're going through treatment or even post-treatment. Okay? So just keep that in mind as well. So this is what we're going to be focusing a little bit on today: psychological, education, financial, employment, legal, pharmaceutical, government, and electronic sources to assess. Okay? Psychological. So everyone, when patients come into our centers, they have to look at how they're going to be formatting their treatment plan. So a lot of it is sometimes the emotions don't hit them right then and there. Or sometimes I have patients that after they find out about the side effects from chemotherapy, then things start becoming real to them when they might be losing their hair or their skin might change. And those are things that really need to be addressed either by the nurse or by a social worker or by a therapist. And I think that's something that we still have to remain to continue as a primary focus when discussing these things with our patients, because that is still a very big part of their treatment plan. So, reaching out to oncology social workers to help with that emotional aspect of it, to focus on, how are these patients going to go through treatment? Do they need to apply for disability? It's easier sometimes to apply for disability in the beginning than as you're going through treatment, and then you're applying last minute when you're unable to work at all. So, measuring that emotional distress is extremely important, and also your current stress available. So, how everyone says you have to manage your stress. So what does that look like? How do you manage your stress? Do you need to, sometimes people need to meditate, or they have to, obviously, they do guided imaging. Before you do anything strenuous, you might want to check with your doctor, of course. Okay? So do your own homework. Do your homework. So sometimes with patients, I've interacted with them, and they told me that when let me back up here. So when you come into a cancer institute or into a hospital setting, they give you what's called an after summary sheet. They give you a list of your next appointments. They give you a list of your labs, your medications that you're currently on. That's important when you have to compare them versus the bills that you're receiving from the hospitals, and making sure that matches. And also, sometimes when you actually speak to your insurance agency, ask them, do I have a caseworker that can help me with my, if I have any questions with my insurance plan? Sometimes when things are not approved, that person might be your biggest advocate of directing the appeal to that person, so they can be on your side as well, especially when we wouldn't want any delays as far as treatment. Okay? And, your nurse or doctor will tell you what type of treatments are required after your treatment has ended. Okay. So Dr. Google is not always the best thing to look at. I always tell my patients to make sure that they're looking at reputable sites. So I put some reputable sites that I direct my patients to, and I wanted to highlight some of them for you here today. Some of them have a lot of information online. They have webinars like Cancer Care. You sign up for them. They go for 1 hour. It's a huge resource. So does the Leukemia and Lymphoma Society. One of my new favorite ones, actually, because you find these different resources either working with patients or you go to different conferences, is called Stupid Cancer. And Stupid Cancer is for patients under the ages of 15 to 39, and they focus on their issues at that point. During the fertility questions, are you able to work? How are you going into treatment? And they basically, it's a database that they interact with you and try to link you with other services. So that's one of my newer favorite resources as well that I've been using a lot with my younger patients, whether they have breast cancer or lymphoma or things of that sort, so they can speak to people their own age that they feel comfortable and they can connect with. Okay? Financial resources. So I put two of the ones that I know have good amounts of resource. Everyone wants. I work with patients that they want money and they don't understand how to do it. So Leukemia and Lymphoma Society actually can help with copay assistance. They can help with travel assistance. So a lot of it is just calling having that patient take the time, registering that patient, either in the office or having them call the Leukemia and Lymphoma Society and telling them about all the different services. Cancer Care actually provides a copay assistance foundation, a financial assistance barcoded application, and each application is barcoded. So the patient has to call there directly, and the doctor must sign off on it before anything is sent, and has to verify everything, of course, as well. So I put a few more there, too. Okay? So let's see. A lot of it is still with the financial resources is, working with those financial-based organizations, whether it's Catholic Charities or First Call for Help. They have a lot of databases as well. United Way. They even have transportation options. So for patients, and so does the American Cancer Society. So those are things for you to consider. A lot of it is asking questions, finding out what services are actually active at this time, and sometimes it can change from month to month, okay? So employment and legal sources, okay. So cancer and careers is, my favorite is, their focus is be the boss of your own cancer. So they actually have coaches that are absolutely for free that can help you with your resume. They tell you what to say to employers. They talk about checklists when you're out of work. They talk about checklists while you're looking for work, where to look, how to look, and how to really coach yourself. Something I enjoy doing at Memorial is the fact that actually being there with the patients and, telling them, we do basically role play interviews with cancer patients and saying, listen, these are different questions that can be asked upon you. How are you going to answer them? And a lot of it is building that patient's confidence and realizing that they would be a benefit to the company that they would be applying for. So figuring out how they can, working with the patient, and sometimes role play would have to be involved. Okay? So pharmaceutical medication resources. So here we are with that. So a lot of it is, you have to think about switching before an online pharmacy. You have to look at the advantages and disadvantages and seeing if a low-cost option is the best for you, or, just like MediMeds is actually linking you with different programs that are reimbursed back to, they would come directly from the pharmaceutical company. So you might have to provide different incomes, like a taxes or things of that sort, in order for that to, for you to be approved for it. So a lot of it is, looking online, knowing your medication, and you have to investigate a little bit as well. Finding the program, seeing if you meet the qualifications, and then moving forward with your medical provider. Okay? So, or finding out from your insurance company to see if you have for pharmacy too. So, seeing if that's an option for you as well. Government resources. A lot of it is, pretty standard resources. The Medicaid, Medicare application, the Alliance of Aging, Social Security Administration, and the healthcare.gov for the exchanges. So a lot of it is just looking online, having patients work with the individuals, whether like an ACA navigator needs to be involved with a healthcare exchange, and also finding out what your doctors are contracted with. So a lot of it is, that's great that you found all these different plans, narrowing it down with the patient. Okay, these are the ones that are accepted by this doctor, and checking each doctor what you have available for. Okay? So, and then the next one. This slide is about tracking your money and where it goes. So every single time they say, well, I don't know how much I paid for my deductible. So a lot of this is just tracking your money, seeing where it goes. It's a great way if you use it for your taxes, if you it's keeping you organized. This is trying to make things less worry, and this is a free resource. It's called Simply, and it's something you can do online. Okay? Food for thought. This is another thing about, the difference of in-network, out-of-network benefits, and FSA accounts. So that's a good resource in order to describe a lot of it as well. I know we have a brief time together, so I'm trying to give you an overall resources and where to go from here for finding out more information. So this is one of my, it's a newer organization. It has been in play for almost about a little over 10 years, or just about. This is called the Jack and Jill Late Stages Foundation. You do have to have advanced cancer. You need an oncologist referral. Most patients actually have to have almost about 2 months to live, and they have to have children between the age of 3 to 18 years old. So, and their focus is treating the families and not the cancer. So, I ended up last year. I had a patient that had advanced breast cancer. Her oncologist did approve her for going on a cruise, and she took a week-long cruise with her husband and their 2 children, all expenses paid. They went to they went to the Caribbean and they had a great time. And they have to, obviously, there's qualifications that you have to go through as well. But it's some of these organizations that are extremely important to consider when you're looking at the whole patient, and you are, that has still been, the whole family has been affected as well. So, and then below this is about cancer resources, and you can look to see what they have there. And I would like to end with a quote: more than 10 million Americans are living with cancer. They demonstrate the ever-increasing possibility of living beyond cancer, and that's by Sheryl Crow. So if you have any questions, let me know. Again, my name is Elizabeth, and I want to thank you so much for being a part of this, about being a part today.
Thank you so much, Elizabeth. That was great information. Our next speaker today is Shelley Johnson. Shelley Johnson has more than 20 years of healthcare experience in both the provider and insurance arenas. The focus of her career for the last 12 years has been in community-based oncology, providing administrative, financial counseling, and AR management for cancer and hematology patients in Brevard and Indian River counties. Her unique experience has allowed her to pursue her goals of providing not only excellent care to her patients, but equal and affordable access to care for all patients in need, regardless of their situation. Shelley attended Ohio State University and Kaiser University. She currently lives in Melbourne, Florida, and enjoys spending time with her husband and sons. I'd like to introduce Shelley.
Thank you, Gail. My name is Shelley Johnson, and like Gail said, I've been in this arena for probably 20-plus years. Primarily, my focus on a daily basis is financial counseling for the oncology patients in the community setting. Now, the community setting has challenges that most of us probably know on a daily basis. The biggest problem that we see is some of the changes in oncology with the finances. 10, 15 years ago, it was not an issue with, how much was the copays and, were we going to get covered for the cost of the medication. They've actually had to define financial toxicity nowadays. The basic definition of financial toxicity is the rise in the cost of cancer treatments to both patients and providers. The impact is on both sides of that, both the patients and the providers. The main stress points that we see nowadays is the patients struggle to understand what their plan benefits are. 2017 has probably been one of the most challenging years that I have seen in doing this with all of the changes in the marketplace plans. We've had plans that have pulled out in 2017, so there's limited resources for the patients to go to. Not only do they not understand why they've got limited options, they don't understand their benefits or what the core information is that they need to understand. The financial shifts, we've seen higher deductibles than we've ever seen, larger coinsurances. We've seen some patients that will come through with a 50% coinsurance for chemotherapy. That financial burden to the patient is significant. The authorization complexities, the authorization requirements out there, as we said before, if you have an insurance company that has an option of case management, that's going to be an excellent financial resource for us to be able to kind of strive through some of these delays that we see in authorizations. Now, from an office-based community setting, how can we prevent the financial toxicity on both the provider and the patient? We need to verify the benefits. Sometimes the resources online are very limited. Sometimes you've got to pick up the phone and really get into talking to somebody on the other end to know how they coordinate benefits between the primary and the secondary. If it's a secondary to Medicare, are they going to cover the coinsurance? Is the patient going to have a coinsurance for these expensive medications? We do financial analysis for each patient coming through the door, we're looking at, do we cover the cost of the medication? Some of the Medicaid fee schedules are lower than what we pay for the medication, so we have to be careful of those. We're looking at the ASPs and finding out what the patient's coinsurance would be if they do have a 20% coinsurance. Sitting on the financial counselor side, we're looking at those coverage policies. We're looking at the medical records that the doctors have dictated to make sure that there's not a, fail first thing, that they don't have to have failed a prior, like platinum therapy or something along those lines, in order to even gain coverage to these medications. The biggest thing that we can do is enroll with the programs that the manufacturers offer. Every patient that walks through the doors at Cancer Care Centers of Brevard is enrolled into the drug benefit investigation programs that will allow us to partner with the drug companies. Now, this is for branded drugs only, but every branded drug out there will have a resource available to us where you can roll in a benefit investigation, allow them to do a benefit investigation separately from what you do, and then you can compare the two to make sure that you guys come up with the same answers. There are times where we're getting 2, 3, 4 answers from the insurance companies. So you want to try to make sure that you get the correct information from the insurance to relay to the patient. And we have to communicate with the patients what their financial responsibilities are. If they don't know, then they can't make an educated decision on what they want to do with, the coinsurance and see, if there's assistance out there for them. Once you get the information, you've got to communicate it to the patients. When I communicate my coinsurances with the patients, I start out with letting them know how much their 20% coinsurance or whatever their copays will be. Now, that amount will kind of send people into shock sometimes with some of the rates that these drugs are, coming up as. But I also let them know that there are resources available, and we're here to help them get through those resources. The patients are, if they're newly diagnosed, not only are they fearful of, the horrible disease itself, they're looking at some of the other challenges. These patients have never been dealt, they've never had to deal with the type of financial toxicity that is coming at them. We've got treatments that will run in an office setting, $1,500 a treatment. That's not something that most people can afford, especially if you're going to do that every 3 weeks. So they hit a very fearful stage on what it will do, how that impact will be to their family. By opting for a treatment, what am I going to do with my family? Am I going to leave them with the any kind of financial responsibility? Am I going to leave my family with debts that we don't have the means to pay for? Some patients are very prideful. I've had patients who they've never needed help before. They're not interested in doing any help. So they will kind of push back on any of that until it comes to a point where they will start saying, okay, it's too much. I think I want help now. So a lot of times it's getting past that pride stage. And a lot of them don't know what questions to ask for. They don't know what resources are available to them. So the resources available for the cost of treatments, if you have a commercial insurance, if it's a branded drug, you have the manufacturer copay program. Most of your branded drugs will have a copay card for the commercial insurances, and there are some patient assistance grants through the foundations that will be able to help them as well. If you have a governmental insurance, they've got foundations that will provide patient assistance grants. Now, this slide is the one that is, hang on just a second, if you're not seeing the browser. Oh, okay. If you guys are not able to see the slides, hit your refresh button on your browser. But this slide right here is going to be some of the main programs that I use. The money is coming in and out. Some of the funding has been depleted for a bit, but you have to look every day because these are every day changing. Patient Access Network, they provide the copay assistance for the medications. Leukemia Lymphoma Society, I want to take a minute just to highlight on their programs available. Not only do they have the available option of copay assistance to cover the medications, they also will cover any of the administration charges. So if the insurance company says that you've got a $50 copay for the administration of the medication, as long as it's on the same day, even the office visits, they will pick up everything on the same day as the treatment itself. What I do for my newly diagnosed blood cancers that would fall under the leukemia lymphoma, I will also speak to them about the option of using the leukemia lymphoma for premium assistance. If you've got a patient who is covered under traditional Medicare or even one of the managed care products, the Medicare replacement plans, I will talk to them about thinking during the open enrollment period about looking into doing like a Medicare and a supplemental insurance. If they're on a managed care because they're not able to afford the 20% coinsurance, the leukemia lymphoma will reimburse them back for any of their premiums. So if you look at that, I just tell my patients, if you set 2 months' worth of premiums aside, you'll pay your premium, and then the leukemia lymphoma will reimburse you back that premium, so they can use that as kind of a revolving money circle. And then they don't have to worry about financial responsibility for any of their medical services if you have a supplemental insurance that covers everything after the Medicare program. Cancer care. Cancer care has a fantastic book available to patients. It's called the Helping Hands Resource. They used to print a hard copy of it. I believe they've stopped printing that. But if you Google the Cancer Care Helping Hands Resource, there's a 120-page, I believe, document that patients can go look at. You'll be able to find things by diagnosis. And in each category, it'll tell you what assistance they offer. One of the first things in the book is something on the Actors Fund. So you have to be an actor in order to be able to qualify for anything under that fund. But it's something that they can do to have, in their spare time, look to see. It will look for housing. It'll do transportation, everything like that. Now, a lot of the patients will come and they don't have the money to take care of some of the daily expenses that, they can't afford their rent, they're having trouble with their utilities, things like that. There are resources out there. The Cancer Care Foundation or the Cancer Care Financial Assistance will have information in there. There are also 2 foundations here in the state of Florida. There may be more. These are the 2 I'm aware of. We have a foundation at Cancer Care Centers of Brevard that is available for patients in Brevard and Indian River County. You can apply online, and it will help with living expenses. It will not help with any medical bills, so the copays to the doctors, your copays for chemo, anything like that, it will not help with that, but it'll do a lot of the robbing Peter to pay Paul. So it'll pay your electric bill, so that'll free up some money, so you'll be able to take care of the other stuff. Florida Cancer Specialist also has one. Both of those programs, both of those things you do not have to be a patient of those facilities to be able to tap into their resources. They're available for any patient that is impacted with cancer. The only thing is the Cancer Care Centers of Brevard Foundation is limited to Brevard and Indian River County. This is one of my favorite things on success. And together, with hitting the financial resources and all of the other resources that were went over earlier, we'll be able to get everyone access to the care that they need in order to fight this horrible disease. And if you have any questions, I am available for questions.
Thank you, Elizabeth and Shelley, for educating us on this important topic. Now we will open the floor to any questions.
And as we unmute everyone, if you're not speaking, please mute your own phone so we don't have too much background noise.
All guests have been unmuted.
Can you guys tell me how to mute my phone?
So it looks like we had someone ask a question. Patients applying for a job have to inform the potential employer. Elizabeth and Shelley, do you guys have any thoughts on this?
Pound 86.
Okay, so my thought on this is if it depends on the type of job if they're applying for it. If they're applying for a part-time job, I would almost not say, I would not actually say anything to the employer. I would just say I'm not available those days. Not saying that you're trying to be a team player, but you're giving them what you can do and focusing on what you can do versus what you can't do. And sometimes employers don't understand that a lot of patients actually can work during treatment and still be as productive as they were before. They might have to adjust their hours, they might have to adjust their desk and their setup, but I have a lot of patients that continue to work during treatment. So a lot of this it depends. You know, it depends on what you feel comfortable with that employer, what their mission is, what they're trying to do, and what you feel comfortable, what questions you feel like answering for yourself at that point. I hope that helps.
Thank you.
Thank you. Another question. I've had difficulty locating financial resources for patients with small cell lung cancer. Are you aware of any resources?
Great question. This is Shelley. Small cell has been one of the diagnosis categories that we just haven't seen any funding with. Now, the one thing that I can refer you back to is for anyone that you're being treated with small cell lung cancer and there is not any financial resources available, reach back out to the drug companies. For the branded drugs, there are some programs out there, some companies that will be able to fill these gaps with free drugs. One of the prime examples right now is colorectal cancer. Colorectal cancer, the copay assistance has depleted. I believe on Monday it opened up for a very short period of time. I got my patient's income. I got online and it was gone. They're coming and going very, very fast. But Genentech has a program that in these gaps that we are finding that they are able to come in and provide free drug for some of these patients. So my recommendation on this would be to, if it is a branded drug, to reach out to the company to see if they've got a program available that would provide free drug during these periods where the patients aren't able to get access to the medications.
Thank you. That was a great question. We will be sending out the slides after the meeting via email, and they will also be posted on our website, which is www.flasco.org. Does anybody have any other questions? Okay, we have one here. Is there any assistance for generic drugs?
Generic drugs have always been one of the toughest things. Generic drugs, there is not any manufacturer support for those. So what you would do with the generic drugs is reach out to whatever foundations have money. They will support generic drugs. Some of the programs will have dollar limitations. You have to be careful on doing some of them because if you're looking at a coinsurance of $5.25, they may have a dollar limit. Some of them have $20 to $25 minimum per data service that they will reimburse. But the generic drugs, you can still look for assistance through the charitable donations, through the foundations.
Great. And here's a good question from Stacy. It says, one of my patients was just approved for Medicaid. She is very overwhelmed with what managed Medicaid plan to choose. Is there somewhere she can call to help guide her in selecting the right plan for her?
I wish there was a place. That is a great question. Unfortunately, the Medicaid actually sends you out a list, and Shelley, correct me if I'm wrong if you think of anything as well. Shelley, there's a list that goes over each plan and what they have available and the rights of the chart that they have. And sometimes it's almost better for you to speak to the people in the office that are doing the authorization, say, which plan is best for me, and you're right, someone actually said they have choice counselors, so they can try to get a hold of them. Sometimes it's a little of a wait, and they have to just be patient with that, too. And also speaking to the office to find out what their contracts are with as well.
Yeah, and the other program that I will refer to patients to on a number of occasions is the SHINE the SHINE program. In the state of Florida, SHINE is serving the health insurance needs of the elders. It also does have programs available to help with any questions regarding the Medicaid programs. There's a 1-800 number if you Google SHINE, or I can give you, let's see, it's got to contact us. Let me get you a phone number. There's a toll-free number. It's 1-800-963-5337. And what I do is I refer my patients to them. I ask them to please make sure that when they get a hold of the SHINE office that they have a list of their chronic conditions, a list of their medications, a list of what's important to them. The thing that we're finding in the community base with the oncology is that you'll have your surgeon who's on one of the Medicaid plans and your oncologist on another Medicaid plan, and we don't seem to be able to find, patients that have, oh, okay, this plan has all of my doctors that I see on it. So that tends to be some of the challenges that the patients are faced with those Medicaid plans, and it is very overwhelming for them.
Additionally, besides Medicaid, SHINE can also help with Medicare, too, and coming up with those Advantage plans. They can look at that as well. Okay?
Wonderful. Did we have any other questions from anybody? Okay. So if there are no more questions and answers, then basically I'd just like to thank the speakers. Thank you so much. That was a very, very informative presentation for both of you. Also, thank you to all the attendees today. We had a very, very good turnout of over 70 people, so thank you. Just wanted to give a quick little update. The FLASCO Administrator Network Group will be hosting a track, an administrator track, during the FLASCO Spring Session on April 1st, 2017, at the Gaylord Palms Resort in Orlando. So we've actually reserved the Sybil Green from ASCO, who will be joining us to speak on MACRA. We'll also have topics regarding presentations on OCM and MIPS. So those are big hot topics for us now. But FLASCO is holding also the Business of Oncology meeting on Friday, March 31st, at the Gaylord Resort in Orlando. This amazing meeting brings together the varying stakeholders, oncologists, pharmaceutical industry reps, payers, national oncology organizations, and patients to discuss and debate topics such as alternative pay models, value, and affordability. I would like to encourage you guys to attend both of these meetings if you can. If you have the opportunity, they're definitely very informative, and you definitely get a lot of value out of it. So we'll be sending more information via email, so hope to see you there. Thank you again to everyone for your participation today. Have a great